Well, hey guys, in today's video, I'm going to be talking about the different root causes of patchy hair loss in the beard area. Number one, alopecia areata, autoimmune hair loss. Most commonly affects the scalp as well as the beard area. All of a sudden, out of nowhere, you have a patch of baldness in the beard, usually oval to round, very smooth. What happens here is that your immune system, maybe because you're stressed out or you recently were sick with a cold or flu, you had a major stressful life event like a surgery, your immune system gets a little annoyed, confused, and it attacks the hair follicle. You get a sudden loss of hair. This can happen at any time. It's the most common cause of hair loss actually in children, but when we're talking about the beard, the average age of onset is in your 30s or 40s. This is a condition that can go away spontaneously on its own, but it can also recur. Once it's confirmed that this is what you're dealing with, how to get rid of it? Well, there are a couple of approaches. The first one is the wait and see approach. As I said, a lot of cases just spontaneously go away on their own. You don't need to pursue anything. You can just ride it out. But for more stubborn cases, or to make it come back faster, the standard approach is to use a topical steroid or to inject steroid medicine down to the follicle to suppress the immune attack against the hair follicle. Sometimes you may even benefit from taking steroid medicine by mouth. The medication is called prednisone. It calms down that autoimmune attack and can help hasten regrowth. A couple of weeks ago, I did a whole video on alopecia areata. So check that out, because for cases that are more involved, say your scalp, your brows, medications like JAK inhibitors, these tackle a specific arm of the immune system, may be indicated. If you have alopecia areata, there is an association with some other health conditions, namely hypothyroidism, vitiligo, an autoimmune attack against the pigment producing cells in your skin. Also, like I said, it can be triggered by stress, illness, so recurrences are possible. Pseudofolliculitis barbae, that is a fancy medical term for ingrown hairs. Really common, especially in men of African descent, related to the shape of the hair and the hair follicle. It is elliptical and coiled. So what happens is, as the hair is growing out, it pierces the neighboring skin, grows downward. Your body does not like that. Hair outside of the follicle is not something that your immune system wants around, and it comes in and attacks it. You get these inflammatory bumps that can fill with pus, and they can go quite deep into your skin, scar, destroy the hair follicle, you get hair loss. A first line treatment to helping this go away is unfortunately just stop shaving. Well, that's not an option for everyone. Some people, their employer requires them to have a close shave. So there are a variety of shaving techniques that can minimize ingrown hair formation. Starting off, switch from a razor to clippers. You want to keep the hair around 0.5 millimeter or more in length, ideally. Also, when you shave, don't pull the skin tight. Don't press down really hard. Shave in a superior to inferior direction, in the direction of hair growth. Don't shave over the same area multiple times. Wash your face with a mild cleanser before shaving. What this is going to do is soften the hairs, cut down on the chances of that sharp point being left behind, and also moisturize after you finish shaving to keep the beard area hydrated, reduce the coarse, brittle, pointy, sharp hairs from piercing the neighboring skin. For men who deal with ingrown hairs, the treatment might include topical antibiotics to calm down the inflammation, as well as acne treatments like salicylic acid and retinoids like tretinoin. These help to smooth out the skin surface, reduce buildup of skin that traps that hair and lets it grow downward. I have a video all about getting rid of ingrown hairs. They don't just happen in the beard area, they can really happen anywhere where you happen to shave or remove hair. So I'm gonna link that video in the description box. I give a lot more tips on getting rid of ingrown hairs. Number 3, folliculitis decalvans. Okay, this is actually something that you probably don't hear a lot about. It is a inflammatory skin problem around the hair follicle, likely related to the bacteria Staphylococcus aureus. It's not super common, okay? And it's not really all that common in the beard area, although it can occur, and the end result is patchy beard loss. What happens here is you get an influx of a cell type around the follicle called a neutrophil. So you get initially a little pink-red bump over the hair follicle. It can become quite inflamed, extend downward, and you get destruction of the hair follicle, and you get hair loss. Now, this is really important because that inflammation can scar the follicle of your beard. And once the scar is there, once a scar forms, there's no growing from that follicle. So you want to diagnose, manage, treat as soon as possible to prevent scarring from happening. A lot of men do quite well with a course of oral antibiotics to calm down the inflammation, help get rid of any staph, maybe a topical antibiotic for milder cases. Also, a course of Accutane can benefit this quite a bit. Some men also do well with what's called photodynamic therapy. Unfortunately, it can be very uncomfortable, so it may not be necessary or right for everyone. Alternatively, we can calm down the inflammation that leads to the ultimate scarring of the follicle using topical steroids or injecting them right into the follicle. Number 4, frontal fibrosing alopecia. Now, we see this a lot in postmenopausal women. Prominent receding hairline, but men also can be affected by this condition. Not only do they get receding hairline, but they can get loss of their sideburns, and it can impact the beard. What the heck is this? This is a condition that is a chronic inflammatory condition of the hair follicle. Also can impact the eyebrows. You can get brow loss. In my opinion, this is underdiagnosed in men. Men with a receding hairline are quick to be diagnosed with pattern hair loss, androgenetic alopecia, told go use minoxidil, but a thorough scalp exam is warranted to identify possible other types of hair loss, because frontal fibrosing alopecia, in contrast to androgenetic alopecia, pattern hair loss, that follicle can scar down, so it needs to be ruled out if suspect, and it can impact the beard. How do we treat it? Steroid medicines to silence that inflammation, either applied to the skin, injected in, or a course of steroids by mouth. Also, there's a class of medications that help quiet down inflammation called calcineurin inhibitors. Tacrolimus, pimcrolimus, brand names Elidel, Protopic. These applied to the skin may help. The anti-malarial medication hydroxychloroquine targets certain aspects of inflammation, can help this as well. I'm really passionate about finding the root cause before pursuing treatment options, because in this case especially, it's easy to miss it. Do not let the sun set on a cicatricial hair loss. Cicatricial means scarring. The sooner you get the correct diagnosis, the sooner you can start the correct treatment options, the better the chances you have of not only regrowth and responding to those treatments, but preventing scarring. And remember, once a scar forms, there's no turning back. Next, pseudopelade of brocq. This is not common. We don't really know why it happens. You get an influx of a cell type from the immune system called a lymphocyte. You get these little patches of hair loss, often in the scalp, but also the beard. It's real slow progressive. So it's the kind of thing that you might not notice. You may notice and people are like, I don't know what you're talking about. But a thorough exam can identify it. Initially, when it starts appearing, if you look around the patches of hair loss, the hairs that are there, they're easy to pull out. Pseudopelade of brocq, you also get redness around the hair follicle. If you look very carefully at the involved places, they almost kind of look depressed. There may be some atrophy going on there related to the inflammation. Round oval. Real subtle, often misdiagnosed, often missed, I should say. It can actually be tricky to manage. I'll be honest, it can be tricky to manage, to control. Good success with Plaquenil, aka hydroxychloroquine, the anti-malarial, because that medication tends to help things where there are a lot of lymphocytes involved. So there's that, and topical steroids. Moving on to something that is a lot more common, and it is seborrheic dermatitis. Kind of related to dandruff on the scalp. Chronic inflammatory skin condition that comes and goes, triggered by stress, triggered by underlying weakness in the immune system, also triggered by changes in the weather, a lot of times flares up in the winter time. It's related to a combination of your genetics as well as an overproduction of oil aka seborrhea, and the little yeast that lives on everyone's skin loves all that oil that your skin has a tendency to produce, especially during flare-ups, and it thrives. Your body mounts an inflammatory response. You get these greasy, red, scaly patches in the beard area. Can also happen in the brows, the forehead, around the ears, the chest. I mean, you can get seborrheic dermatitis anywhere, but when it impacts the beard, because it is inflammatory, it can impact beard hair growth. So it needs to be controlled. Also, if you have a deeper skin tone, seborrheic dermatitis oftentimes will steal some of your color away temporarily. You get these light patches. Fortunately, in contrast to some of these other things we have talked about, this is not typically scarring. Woohoo! But you do need to control it. And how is it controlled? Well, it's controlled with antifungals that are applied to the skin usually. Nizoral shampoo you can buy in the store contains the active ingredient ketoconazole, helps to calm down that little yeast that gets too comfortable in the oiliness. Also, a short course of a topical steroid cream like hydrocortisone, desinide, really can help. Now, a lot of patients end up, having so many flares, have really oily skin. Truth be told, they do quite well with a course of Accutane, isotretinoin. Isotretinoin shrinks those problematic enlarged oil glands. Doesn't get rid of all of your oil glands. It's a common misconception about isotretinoin, but it does shrink the problematic enlarged ones that play a role in this. And there is a drug called tapinarof, Vtama cream. It targets part of how there is inflammation in the skin, and it can likewise help this. Check out my videos on how to get rid of seborrheic dermatitis on the face. I give a lot of tips and tricks, skincare product recommendations in there, more information. All right, here's one you probably didn't think about. It's trichotillomania. Have you ever heard of this? It's something a lot of people deal with, especially when they're stressed out, or maybe they have other problems with their mental health going on, and this is something that goes along with it. Basically, pulling the hair. Oftentimes people will pull their hair out on their scalp, also their eyebrows, but the beard is accessible territory that also gets pulled. Now, this is common in kids. They often will outgrow it, but it does rear its head in adults, adolescents, and the beard, like I said, is not missed. So some people intentionally pull, other people don't realize they're doing it. Once you stop pulling the hair out, it generally grows back. May grow back initially in a way in which you are more likely to form ingrown hairs, but it can grow back. However, if you are constantly plucking and plucking, like with tweezers, methodically, or pulling your hair out, you can get a scar. Okay, it definitely can happen. You may need to see a mental health provider, especially if this is related to psychological stress. Habit reversal therapy can be quite useful here. There's also the use of SSRIs can be helpful. A drug called clomipramine also may be helpful. And believe it or not, the dietary supplement N-acetylcysteine seems to be very useful in the situation of trichotillomania. Talk to your doctor and make sure these things are right for you, what the best treatment for you is if you struggle with this. But there are effective therapies out there that can really help. Speaking of trichotillomania, the next one is kind of related to it, but not pulling your hair with your fingers, but rather traction alopecia. Now, I've quite a few videos on this channel giving tips on traction alopecia, how to style your hair. But basically, just as it sounds, you develop alopecia as a result of chronic traction on the hair shaft. You see this a lot in women here in the temples, wearing tight braids, or if you get hair extensions, happens in the back of the scalp. But any hair can be affected by traction alopecia if you put sufficient traction on it. Now, that can include aggressive grooming practices. Some people culturally, as it relates to maybe religious practices and the maintenance of their beard, they may have certain practices that do put a lot of traction on the beard hair. Similar to trichotillomania, traction alopecia, once you stop putting the traction on the hair, it will grow back. However, if you keep doing it, and you don't get a hold of it, you don't change things up, that hair follicle can scar down. Now, here's something a lot of people don't think about, but if you work with livestock, farm animals, I've seen a fair number of cases of ringworm in the beard, Tinea barbae. Animals carry the same fungus that can get on our skin and affect our skin, our nail, and our hair. And in men, it can impact the beard area. And it can be quite inflamed. Goes down the hair follicle, you get this big sinus, can be quite deep, and it requires an oral antifungal medication to treat. Can't just treat it with an over-the-counter antifungal cream, like those fungal creams I point out that are used to treat, or to try and treat foot fungus. That's not gonna work here because the fungus is down too deep. You need an oral medication. Speaking of infectious causes of loss of beard hairs, y'all, it's on the rise, okay? Syphilis. You don't want to act like syphilis is something of the dark ages, because it is on the rise. Recently I did a video all about syphilis, signs of syphilis. Hair loss is a sign of syphilis. It's classified as a non-scarring alopecia, but if identified as a clue to syphilis and then you find out you have syphilis, it needs to be treated. Untreated syphilis is not anything that you want to have going on. And so how do we treat syphilis? With antibiotics, penicillin. So the hair loss with syphilis, often the scalp, but also the beard, it's referred to as moth-eaten alopecia. Kind of looks like if you left a wool sweater in a closet, let moths attack it, eat it, kind of have these little gaps in there. That's what moth-eaten alopecia of syphilis looks like, and again, can impact the beard. And last but certainly not least is acne. Acne in the beard area, because it's inflammatory, it can lead to hair loss. Now, treating the acne, you can get the hair to grow back. Patients develop patchy beard loss as a result of the inflamed acne. They go on isotretinoin, or they use a topical retinoid, or they use standard acne treatments, antibiotics, get the acne under control, the inflammation dies out, and slowly their beard hair returns to normal. But if you let the acne go untreated, especially cystic acne, any kind of acne, but really especially cystic acne, does leave scars. And if it scars the follicle, there's no turning back there. I'm making this video not to give you recommendations about what products to buy, what to do to get a fuller beard, because you need to know the root cause of why you have developed patchy beard loss. Yes, it's true, some people, due to their genetic makeup, do not have a full beard. I want you to always keep in mind the root cause. Knowing the root cause is key. Otherwise, you are not only wasting time, money, resources, exposing yourself to potentially unnecessary risks, but you could be sleeping on a cicatricial alopecia, and once that scar forms, there's no turning back. All right, y'all, that's it. On the end slate, I'm gonna put a recent video I did all about frontal fibrosing alopecia. If you've got a receding hairline, watch it. If you enjoyed this one, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.